Welcome everybody to this brown bag session. We have Thomasine Heitkamp and Lavon Fox and David Terry from the Mental Health Technology Transfer Center presenting on their new toolkit, which they will explain. And a few housekeeping things, please mute your mics. Also, if you are having any difficulty with unstable connections or anything like that, please turn off your video. That seems to help a lot. And we will do questions after the session. And so they'll go through their slides and their presentation, and then we'll take questions after that. So welcome, Thomasine, Lavon, and David, and you can take it from here.
Great. Thanks so much, Sherry. So my name is David Terry. I'm the program coordinator for the Mountain Plains Mental Health Technology Transfer Center. And for those of you that might not know about our work, the Mountain Plains MHTTC is one of 12 centers that make up the larger MHTTC network. The MHTTC network is funded by the Substance Abuse and Mental Health Services Administration to provide training, resources, and technical assistance to individuals serving persons with mental health disorders. The Mountain Plains MHTTC serves the states of Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming, and has a particular focus on supporting providers working to meet the mental health needs of individuals living in rural communities. A very brief disclaimer. Today's presentation is provided free of charge by the Mountain Plains MHTTC. Today's presentation is available in the public domain and should not be distributed for a fee without the express written permission of the Mountain Plains MHTTC. And the views and opinions expressed during today's presentation are those of our presenters and do not reflect the official position of the Department of Health and Human Services or SAMHSA. And as I mentioned, we are funded by SAMHSA to provide today's training and all of our trainings. And as part of receiving this funding, we are required to submit data related to the quality of our training. If you could take a very brief moment to complete an evaluation about today's training, we promise it's a brief survey. Your responses to these questions are anonymous, and we do use this information to improve our future trainings. And with that, I will turn things over to Thomasine.
Hello everyone, Thomasine Heitkamp here. Please, so many of you can join us today and enjoy your lunch while you're hearing about a new product that we have. The Mental Health Technology Transfer Center brings in about $1.4 million a year to the University of North Dakota. We have a couple $100,000 supplement to deal with issues of well-being during the pandemic. We also have a $500,000 we get a year to do school mental health, and then we have a major grant. So it's a pretty significant effort. So when you see us wandering around the second floor of Northern Plains, when we can be in, it's a great staff that does a lot of work, really focused on expanding capacity. And one of the projects is the school mental health grant. And we really focus as part of our effort and thinking about language and always using person-first language. And one of the things that we noted when we first started this work, we're always going back and changing our slides. We're always going back and looking at products to see if we're using person-first, non-judgmental language. We also run an addiction technology transfer center that brings in about $750,000 a year to the campus. And we all deal with issues around language, particularly as it relates to substance use disorder in our work. But this is a slide that we show in all of our trainings to just remind people of person-first language. And we're going to be talking about language as it relates to Indigenous populations. So it's a great way to start. So welcome everyone. We're tickled pink to talk about MHTTC and in particular the school-based product. Throughout the session, David Terry will be putting links to products that we have. Everything we do is free. We just want you to let people know we're doing it. The trainings we do are recorded, slides are out there, total transparency with this product in terms of what we're doing. So next slide, David. So this is the new product. Lavon Fox, who's with us today and can't be up in video because she has some bandwidth issues. She works at the Turtle Mountain Tribal College and is able to join us from that area. Strengthening resilience, promoting positive mental health among Indigenous youth. This is a stunning piece of art that Mark Lewis Wagner is allowing us to use. And Levon will talk a little bit about the real important significance of the turtle, and the turtle's carrying the North American continent. So he let us use this free of charge. It's really sets up the product. The other thing I tell everyone is we are getting written copies of this book. It's about 50 pages. And for those of you who hang in there, we will send you a written copy of this book at the end of the session. If you just send us your name and put it in the chat box, we'll send it to you. So we're very proud to unveil this. This is our first unveiling of the product, so we're glad to do this. Next slide. The purpose of the document, and you know, like everything we do, it takes a while to think about who's our audience, who are we serving. And Levon's, with her work, she was a faculty member in the Department of Occupational Therapy for many years. And when I heard she was retiring, I said, come and work for us. And I'm just thrilled to have Levon as part of our team. We talk a lot about who's our audience. For this product, we really did a broad sweep. Our audience really is educators. And I see folks from College of Education and Human Development online. It's great to see you. I think this is a product you could use in your classroom and share with your students. And it's out on the web for free, and we'll send you hard copies. But it really looks at the complex issues of serving Indigenous youth and how we do that in our academic environments, K through 12. How we do that as school counselors, how we do that as social workers working in the community, educators, administrators, the broad sweep. So I see Sherry Hudak on with us. You know, that's something that could be used in higher ed administration. We really take a dive into trauma and the role of trauma and some of the behaviors you're going to see. We have a couple other products like this, and our brand is kind of taking a fictitious case and then wrapping information around that fictitious case. So you'll hear about Carly today, and the linchpins really are the circle of courage and the 7 teachings that that Levon will be going over. So we really think it's a broad audience. We hope you will share it. Next slide. And I see David's putting all that information in the chat box. So I'm going to turn it over to Levon to talk about, like everything we did with this. We talked a lot about language, what language should we use, how should we, because we started with Language Matter as part of MHTTC. So Levon, take it away. I will pick it up in the end again, but I'm glad to turn it over to Levon, and we'll go over a couple slides in between.
Hey, thank you, Thomasine. So yeah, as Thomasine said, it said my internet's a little unstable or my connection is unstable, which I said reflected my brain some of these days for those of you that know me, and unfortunately my computer's agreeing with it. So when we look at language matters, one of the things I always hear people say is, well, what term do we use, or how do we call, you know, people, or how do we name them? And it's like, well, basically for this document anyway, we looked at the term Indigenous. Indigenous is a movement, of course, that's going across First Nations and across the United States as well. So the term Indigenous means when you're addressing Indigenous groups collectively. And Indigenous comes from the Latin word indigena, which means sprung from the land or native. But the thing is that it's best to always use the tribe's specific name and acknowledge the territory where each nation currently resides. So for the federal government, they use the term American Indian, Alaska Native. Then there was the term Native American, which was challenged by people because people feel if they were born in the United States, then they were all Native American. But all of us would prefer, I'm typically comfortable with Ojibwe or Chippewa, and some of my friends are Lakota and Dakota. So it just depends on what they prefer to be called. And you just ask. If you just ask, there's no, they're not offended by that either. So if you could go to the next slide, the other thing that is slowly changing as we progress through this decade, I guess, this new resurgence of Indigenous identity is looking at the territorial acknowledgement statement. And that's part of because Indigenous people have been basically written out of the history books as far as what their contributions were and the fact that they actually did exist and still exist. So people have started adding territorial acknowledgement statement. And so when you look at where you guys are today, if you are in the Grand Forks or um, Fargo area, all along that, and all the way actually into Devil's Lake in the northern part, then you're actually resting on the ancestral lands of the Pemmican Red Lake bands of Ojibwe and the Dakota Oeta, presently existing as parts of Red Lake, Turtle Mountain, White Earth bands, and Dakota tribes of Minnesota and North Dakota. So that acknowledgement at least recognizes that Indigenous people were here and remain here. So in the next slide, we are looking at why I said earlier, when you look at the barriers or the not acknowledgement of that Indigenous people were here and what their name is, it almost goes to part of where if anybody's watching CNN last week, I mean that pretty much summed up what I mean by the lack of acknowledgement. So when Indigenous people were labeled as something else, and whether that was directly connected to us, we really didn't care. That's how we viewed it. And so what you saw go across Indian country then was people started getting T-shirts of "That's right, I'm something else," or there was all these different taglines in there. But this has been a pattern within our country, and this actually is contributing to what some of the issues are that we see today. So in the larger historical content, there's the scar of just racial hatred. I think some of it stems from the fact that when some groups look at Native Americans or Indigenous Americans, you see maybe what you done. It's almost like a self-reflection piece, not you specifically, but what the nation has done or what the challenges still are there. And so we're continuing to see that those challenges continue as far as racism, discrimination. Boarding schools, I'm still amazed how many people don't realize that Indigenous children were removed from their homes in the late 1800s into the 1900s and forcibly removed and put into boarding schools. The goal of the boarding schools, of course, was to, if you ever heard the saying, kill the Indian but save the man. So it was focused on cultural genocide, to remove the culture. And the one way to do it was to remove them from their homes and from their communities. This has had a definite impact on what we see as far as health today and education challenges today. Then we have the historical and intergenerational trauma, and that has impacted self-identity. And I always give this example that I think is really sad when I look at it. But when I was younger, I did not want to identify as Native American because the Native Americans that I saw in the media and that in the books did not reflect who I was or who my family was. So we would play cowboys and Indians, and nobody wanted to be the Indians. And I think that's pretty sad when that's your cultural identity that you are in denial of because of how it's been presented to you, or even how it's been invisible. Invisible that there was positives within your culture. So it's had a definite impact on the issues that we see today. And then the use of microaggressions. So we look at harmful communication that's both intended or unintended. And again, if you go back to the picture with being identified as something else, as though you don't even exist because a thing is not a human. I mean, that's not the way I would look at it, or that's the way I would look at it. So that was pretty detrimental to the tribal communities with that. But luckily, I think one of the protective factors of Indigenous people is that you add the sense of humor, and they took it and ran with it. So on the next slide, I'm going to turn it over to Thomasine quick here so she can discuss the barriers, what I talked about with the boarding schools and the barriers to care.
This is a photo of the first boarding school, Carlisle Boarding School in Pennsylvania. And what struck me about this photo and why I popped it in this slide and we use it in the document, I have looked for one child smiling. One child that seemed to be enjoying the day. So you can see the impact of boarding schools. And if you look at the chat box, Sherry just put a notice to Prairie Public, just did a video on boarding schools that's been running. So the Carlisle boarding school really was a powerful image, and we still have boarding schools today. The case that we're going to review, Carly was in a boarding school. And people don't always understand that as well. So I think this is a powerful slide. It's in Ping. If any of you want to use it in your classes, you can just grab it. It's in Creative Commons. So that's where I grabbed it. So next slide. So really some of the barriers when I think about trauma, as part of the MHTTC, we have a lot of expertise in addressing trauma. Levon Fox does that training for us. Dan Foster, who's a psychologist, as well as Tammy Dakota. And what I have learned from them is the power of understanding trauma in the context of behavior and really, really digging deep into understanding trauma. And one of the biggest barriers we deal with, not just in the work we do with our tribal nations, but the work we do in our rural communities, is the lack of access to behavioral health care, just a critical access. David Terry and I were at the Billings Indian Health Service last year. We're doing some work up at Fort Belknap, had a pretty serious suicide cluster there. And we were sitting in the office of the behavioral health unit, and over half the positions that were on the wall were vacant. And you see that the capacity, and Great Plains Tribal Chairman's Board, some of the Indian health services in our region struggle to get workforce. And then the lack of funding once they get it. There's just not enough funding. And then the stigma, the lack of awareness, generally among all our populations about the stigma of receiving mental health treatment. While we see that's getting better, there is some perceptions oftentimes of shame. We definitely see that in the substance use disorder work we do, of the stigma preventing access to care as well as provider. So staffing shortage, vacancy rates I've mentioned. And then what I have learned, and this is the trainers that work with us and the experts that come to us have taught me, because it used to just roll off my tongue, evidence-based practice, we're going to push evidence-based practice. Well, a lot of those evidence-based practices are not practices that really are promising in working with Indigenous populations. So thinking about what is evidence-based, what is the cultural piece and overlay when we talk about evidence-based. And what Levon showed us from that screenshot she took of the screen, something else. And so thinking about, sometimes I've learned to think about that honestly as a microaggression. So really thinking about what that means when we talk about science. Next slide. And you'll see the document is got a whole bunch of really great photos. And this is one that Levon had in an original document that really not treating trauma as an erosion of the beads on a beautiful piece of art. So, and you'll see all these really wonderful images in the document. Next slide. So I don't want to review all of this, but when we started to work on this, I said, oh, how do I get all this current data? We were in CDC, we were in SAMHSA, we were in ACF, we were struggling to find data that really was current, that recognized some of the social and health inequities. It sits there, but to get a nice summary of it, but one of the things that we hear in the work that we do, and we work with a lot of tribal nations, it's primarily the population that we work with, honestly, in Region 8 as we do rural work, is the increase in suicide deaths. We get calls a lot about suicide clusters, and you see that in the data. The overall death rate from suicide is 20% higher for Indigenous populations. For the child welfare workers on this call, we see more of those kids in foster care. And you see that 50% of Indigenous youth live in poverty-stricken neighborhoods, and 62% live in low-income households today. So the overlay of poverty, the overlay of trauma, the overlay of lack of understanding culture, and so you get to feel a little gloomy about some of this. But then Levon comes to us and talks with us about some models that work. I think the next slide might be Levon's, David, if you click to that next slide. So I'll hand it back to you, Levon, to talk about some of those traditional child rearing practices.
Thank you, Thomasine. So when you look at this slide, this is a significant example, I guess, of how historical trauma has actually become intergenerational trauma, and we're still seeing its impact today. So when children are removed from their homes and placed in these boarding schools, it does contribute to more poor emotional health and physical health, because the children lost the ability to parent. So you were raised by a military philosophy, is basically what these boarding schools were initially. And there's no empathy development or parental, teaching you how to parent, looking at children's growth. And that then you can see how does that next generation raise their children if they didn't have those types of behaviors or role models. And you can easily see as that continues through the generations, you see an increase in suicidal ideation. Indigenous people have the highest rates of suicide and suicidal ideation. Feeling fearful, overwhelmed, and helpless, because in many aspects, there's a feeling of not having control. And that, of course, is, if you want to learn more, it's looking at how Indigenous people have to kind of balance between state, federal, and then tribal laws and expectations. Feeling anxious and isolated. You look at where reservations are placed, they're not placed in the best areas, are they? They're usually out in the middle of nowhere. And so that type of isolation also contributes to feeling isolated individually. What you could see, or what we know that could be seen, is classroom behaviors that can cause concerns. So you might be looking at someone being disrespectful, maybe cheating to avoid failure because they have tendency to want to be perfect, rebellious behaviors, and you could see manipulating others. And there's other examples in the guide to that that you can see that we identified. And there is part of this is because there's a huge, traditionally a rejection of education. Education has not been our friend. Education has basically put Indigenous people, I always say, on a treadmill going nowhere, because every year the students change, but the outcomes don't. So something about this educational process is not meeting the needs of our Indigenous youth. If you could go to the next slide, David. So what we're doing now is we're heading into that 7th generation. If you study Indigenous education and history, you're going to see that there's a lot of focus on what's called the 7th generation. And 7th generation is a resurgence of culture and identity. And so you're starting to see where we're trying to rebuild families and we're trying to rebuild communities. But it's going to take generations to do this. And in the next slide, you're going to see where the example of the fictitious case scenario of Carly. And we took Carly because Indigenous females have a considerable number of different challenges that they are dealing with. If you look at even the issue that's followed across First Nations in Canada, and then the people in Indigenous people in America, we have a high percentage of missing and murdered Indigenous females. So anyway, when we look at Carly, we put her to where in the last 2 years they were in a boarding school, which Thomasine said boarding schools continue to exist. Some of them have changed. We have some boarding schools that are focusing just on girls' schools. Some of them are looking at prep schools. But some of them still carry some of that same mentality as well. And Carly's experienced psychological and physical abuse, especially when she was in the boarding school. You can come to the boarding schools, I guess, or you can come to these types of settings, and you're going to have challenges because your peers are going to be coming from different backgrounds too, and depending on what type of intergenerational trauma or trauma that they've experienced, you're going to see this kind of not always be the best place for youth to congregate. As I said, there are some boarding schools that are different and that are being run by tribes specifically for identity and cultural growth. But what happened was common again, where she attempted suicide and was returned home. And that's, like I said, and Thomasina mentioned, if you go to the next slide, David, there's a lot of suicidality, suicide clusters, and suicide attempts within Indian country. So as communities, we should be creating hope, belonging, and meaning and purpose in the lives of our children and youth. And as educators and healthcare providers, it's all of our responsibility to help affect the change too. Because when you look at these children and youth, nobody wants to choose that type of life or existence, and everybody wants to have a positive identity and foster that. So what we did then in this project is we started to look at it differently. Next slide, David, please. Education is designed basically to be in a linear process, and that's how, that's changing depending on the pedagogy that you choose today. But there's still aspects of that are still inherent in the process and the system. And humans are not linear, and Indigenous people are not linear. And I think that's part of the challenge too, because when you try to sometimes teach them or work with them, or even if, let's take a basic one, you take a story, they're going to share a story. That story is going to go in circles, and eventually they'll get to what the bottom line is. But you have to just kind of wait and listen and process through it. And there's a lot of knowledge connected with that story, but that's how the thinking process goes. And the other thing that has not worked, that is consistent within a lot of our systems, is the deficit approach. We tend to look at what is absent, lack of, or not good at, or less than, as or like it says, or as something else. And that's how we start from there, what your deficits are. What has worked in a lot of these changing communities has looked at strength-based. You look at strengths instead, because a lot of these kids and adults are coming already with a deficit identity. Already they're struggling with that identity and don't see it as a positive. And I was there, and I did not connect with that and make changes until I was in my mid-20s. So I struggled with my confidence and identity as well. But if you take someone and you start looking at just what their strengths are and how we can build on those strengths, they will correct some of those apparent deficits, and they will correct negative stereotypes. And this strength base is the most commonly used that we've seen, especially in the First Nations people, and a lot of tribes in the US are starting to use them too, and the outcomes have been very successful. So next slide, David. So here's one that we took. We took the 7 teachings, and you're going to, if you do some research on this, you're going to see it sometimes titled the 7 teachings or the 7 grandfather teachings, or you'll see some connection to it, maybe in different numbers, etc. But what it is it's a set of guiding values, and is teaching on how to treat others and ourselves, because a lot of times if we don't treat ourselves the way we deserve to be treated with respect, it's hard to treat others. The 7 teachings provide core values to really connect to, and it can be modified for the needs of each tribe, because there's always whether it be the 7 values or the 7 teachings, there's always a piece of that usually within each tribe. And you can also use it to guide behavior in the classroom, and that's what we did in this product, is we use that as one of the I guess the measurements that you could bring into the class. And then we connected it to building a curriculum that supports positive identity. Apologize for that error there. Next slide. So this shows the 7 teachings. And in here it says the 7 grandfather teachings. Like I said, depending on the tribe, it goes in between the two, but it's strength based. So you have the animal representation of the area or the belief that you want to focus on, the value. And you have the eagle, which is love, and that's looking at love of self as well as love of others. So you're looking for activities that allow them to show compassion through their actions and words. You have honesty, and then there you're looking for them to learn to be true to their word and true to themselves. And so the product will bring you through each one of these, and we have suggested activities below. And there's quite a few listed on there that you can choose from to look at your classroom. And I'm saying classroom, but in actuality, this could also be in a clinic. If you're working in a mental health clinic, or if you're working with a group in the community, you can also take and modify these. Even if you're working with an individual, you could kind of bring in some of these terms or think of some of these approaches when you're going to work with that individual. And so you're making it much more client-centered and it's much more culturally based. And then just in the diagram there, you can see how they all connect. I'm developing a master's education program for the Turtle Mountain Community College. And I'm basing this is the curriculum design, and it's based on the 7 teachings. And so each of these I'm going to bring through the graduate student, then as well as this is what they have to demonstrate or bring forth within the populations that they're going to work with. So like I said, you can use it to design a curriculum as well. In the next slide. So when you're using the model, there is a list of do's and don'ts. And I'm not going to go over all of these because you're going to get the product. But there's some things that, that I think that can go across any population. And it's the first one. If we would learn to seek first to understand versus trying to fit what they're saying or what they're doing in our own cultural perspective, we would have far better outcomes. The tendency to when we look at someone, the tendency is to put everything they're doing in how we view things. And that's not going to work. And I can tell you it's not going to work, and it's not going to work because you can look at decades of still having a lot of these challenges present. So let's try something different. Let's try looking at them from their own cultural perspective. And I do this with my own profession too, and I challenged my own profession where the OTs always say, well, occupation first. We look at what they need to do, what's their occupations. And it's not occupations first, it's culture. Culture determines what interventions you should be using. Culture determines what the outcome is going to be. And if you don't connect with that culture, you pretty much should just, you're pretty much going to have less than positive or optimal outcomes. So the next slide, David. So I think when you look at, aren't they cute? They're so cute. When you look at them, I think you have to look at the importance of identity. Identity increases success and it increases protective factors. And that's what we're going to talk about a little bit more in the following then is what are the protective factors that we want to build on? Again, we're going strength-based versus deficit. So the next slide. The second strength-based approach that we used in this product is a circle of courage model. And this was actually developed back in the early 90s. And the circle of courage was designed for the youth population who were struggling with mental health challenges. And Dr. Brokenleg, Dr. Brentro, and Dr. Von Brockren worked a lot with Indigenous populations in Canada. So it has the 4 quadrants. And the belonging, everybody needs to feel as though they belong. If you don't feel as though you belong, do you feel like you exist? No. Then you become something else, right? So we have to develop that community of belonging and being. Mastery is looking at confidence in many areas across those. And for mastery, it's not, for Indigenous people, it's not being that independent number one and you brag about it. Mastery is looking more at that self-control and what are your personal goals rather than being better than someone else. That connects with generosity, where you're looking forward to being able to contribute. I think it kind of shocked the UNDOT department when after 26 years I resigned to come back home, because I wanted to give back. I wanted to give back to my community and I wanted to give back to my people. And I figured I could do a good job in designing that Master's of Education program, and I could make it culturally based on the 20 some years of experience I had. But people, Indigenous people have to feel like they're giving something back, like they're valued, like they belong. So they're all connecting. Independence is the last one, where we're responsible for failure or successes. We don't blame someone else and we discipline ourselves. But we work for the whole of the positives of the whole, not to be striving just for what we do ourselves. That's the cultural belief. Do all people fall into all of these? No, but this is the structure or the model that we took with this product. So if you could change it to the next slide. So taking that circle of courage, we pulled in how we can build protective factors. If we could identify and strengthen those protective factors, then we're going to have much more positive outcomes. And it'll go not only from your classroom, but into the school and in the community. And so we look at some of these things with positive self-image is a huge one. A challenge here is access to mental health services. But if we look at this in a tier 1, tier 2, and tier 3 perspective, if we could bring in Circle of Courage or some other program that builds up these protective factors, we're addressing tier 1 and possibly tier 2. And then we can modify it to address some of those tier 3. Because in Indigenous communities, access to mental health services that is not telehealth, they could be driving 50 to 100 miles, depending on the size of the reservation. So looking at how these all fit into what would be a classroom or what would be in a clinical situation is that sometimes we focus on the technical skills, but those soft skills are so essential for just feeling as though you matter. And then the next slide. So here's how we took and put this into the product to build a positive Indigenous identity. We identified for the students or the classroom that physical would be taking care of your body, body image, and body acceptance. That goes across all cultures, I think. And I don't know that it's getting any better in how both females and males view their body. But that's the focus that we took there. Mind cognitive, we looked at not giving into peer pressure, making good decision skills, learning from mistakes, thinking about a future. Because quite honestly, for many of these students or many of these individuals, both students and adults, you're living day to day. You're just trying to survive day to day. And the future is not always something that you're going toward or see as even that you're going to have. Spiritual, being proud to be Indigenous, respect all things. Don't confuse this with formal religion. Okay, those are two different things. Spirituality does not mean religion. And emotional, learning how to basically be yourself and love yourself. So based on that, in the next slide, we can kind of see how we applied these to Carly and what they would look like. And Carly did work with the school counselor and access telehealth. Even for my son out here, I have to access a telehealth psychiatrist who's actually in New Jersey. So it helps if someone knows that and how knows how to connect things. So that's a challenge right in itself. It's not that people don't want the help. Sometimes you can't even access the help. And then her and her counselor developed a plan, and they used the 7 teachings in the Circle of Courage to build off of their goals and what direction they would go for their interventions. And then Carly was placed on a 504 plan, and the goal was to decrease obstacles and risk factors affecting her learning. So based on what she needs, how can we modify that environment? And then after 3 months, we did see a more positive identity. she did become more active, and her goals then were to develop positive images of Indigenous people within her school and community. And luckily, you'll see in the product, there was also some family challenges, but her father began to identify our therapy for additions related to PTSD. Sorry, my alarm went off that told me I should be done, and I'm not, but I'm trying. Okay, next slide. So looking at this, Indigenous knowledge is what comes to my mind when I look at this, and that's just looking at things that you want to be strength and resiliency based. You want to look at community action. You want things to be spirituality based, and again, that's not formal religion. Spirituality is a sense of being, of loving yourself, and being able to connect with your environment and community. The importance of knowing history is essential. Sorry, but what you learn in school about the history of Indigenous people is not accurate. And so you need to learn more about history, and then how to nurture a strong sense of self and identity. Healthy identity equals healthy people. So next slide. Oh, I'm almost there. Were you coming in on this, Thomasine, or am I?
I think I am.
Was this yours?
Yeah, I'm glad to hop in, Levon. Thank you. As you can tell, it's wonderful working with Levon. Sarah Nielsen, who is an occupational therapist as well, and does a lot of work with their school mental health project, who just got a fellow in the Association of Occupational Therapy, recognizing some of the work she's been doing with this and other work, as well as Shonda Schrader. And we had contributions. Louise Deers, let me assure you, we're going to put this product up. There's a lot of editing that goes into getting this out, and getting hot links, and getting references in the right place, as well as Heather Gotham with our National Coordinating Office for Mental Health Technology Transfer Center, and Jackie Gray over at the Center for Rural Health helped us out as well. But I'm gonna entice you into this product, and I'm also going to entice you to complete the Gipper link, because that's the way SAMHSA knows we do this work. It's got 102 current historical references, 8 additional resources with models. We spent a lot of time looking at models. 4 promising practices. A lot of the SAMHSA resources are very good. I want to mention that David put in the chat box, we do have another product similar to this with rural schools that has been getting a lot of traction. It deals with some of the complications of youth in rural communities and accessing behavioral health care. So the work, before we open the product, I want to say that as I looked at the curriculum that Levon put together, and the Turtle Mountain Community College agreed to share as part of this product, it can be used in any school. It can be used in any clinical setting. These are basic good principles that work and help train our behavioral health workforce. And our work is actually easier when they get trained in the classroom. So I really hope that people use this material in the classroom. And with that, David, can you maybe link into the product, and we'll just walk you through real quick. Some of you have let us know you want access to the hard copies. We'll get those to you. It's good to see all these faces now when you open it up. Oh, all these familiar faces from across campus. It's wonderful. So the product is about 50 pages. It's a book. If you just want to scroll through, we don't want to make you sick. We do a tribute to the author that let us use this wonderful art, and Levon spent a lot of time getting to know him and the artistic work. Big table of contents, so you can grab just the table of contents. The protective factors, for example, there's just a page on that. And we have links to everything you see here. There's hot links, there's active links for everything. So all you need to do is download this from the website. Again, we will be sending hard copies to those who want this. But you see an introduction, you see about the work that we're doing. And I'm going to have you stop at Levon's photo here, because we really wanted to highlight Levon and as lead author, because she not only put this product together, but every time I do something like this, they have to teach me. I was very linear in my approach to this product. Levon's probably smiling if her video was up. I had to back off and think about Carly in a different way. Think about this information in a different way. But here's Lavon with her young people in her life at the headwaters of the Mississippi. And I convinced her, she hates photos, to put a photo of her with the kids. And everyone notices this wonderful photo and these wonderful children that are in Lavon's life. So just doing a little shout out to the photo, Lavon. Next, scroll down maybe a little more, David. You see the case of Carly. You see we spend some time in historical context, David, as you scroll through it. And you have all this information on boarding schools. It's much more than we were able to go through. We did a section on the Indian Child Welfare Act, you know, the genocide of placing children in homes where they lost their culture, poverty, the role of poverty. And I have to say, just stop there. We struggled with what photos to use. How do we use these photos? It was very hard to find good photos. So Lavon thinks we should just start taking photos ourselves and using them in our products and giving a message that provides an important and documents the content, but at the same time is respectful. And not all the photos we looked at were. So as you scroll down more, David, the 7 teachings, you'll have the trauma, the historical trauma, and then we go into the 7 teachings. I want to mention Don Warren is also a consultant, and he's done some work with us on adverse childhood experiences. You'll see that I have an interview with him on our webpage. Smudging, 7 teachings. So all of these pieces are in this product that Lavon put together. Let's go to the curriculum. Lavon mentioned that you can take the 7 teaching. Look at this denseness right here. If you use the circle of courage, there's the mastery. There's some suggestions right in that curriculum. And so you can push this out. And again, you can use it in nursing. You can use it as you work with any population. It doesn't have to be in the schools. So how teachers can use the model, all those wonderful little kids. We do a wrap up. We do the difference between IEPs and 504s. Some of this is we just started talking and then we realized that we shouldn't assume that people know what Indian child welfare is or what are the differences. So actions for Indigenous students. This is based on current literature. It's based on a model that's helpful. So I think we made it. Put your name in the chat box with your post office or your mailing address, and Sherry's going to get out the product if you want it. The slides are on our webpage. This is on our webpage.
I've already taken attendance and gotten all of the information for sending out the booklet, and now is a great time to open up for questions.
No questions from Sherry Hodak, just an absolute congratulations. This is so needed. It is so excellent. From the images to the pictures to the structure that you've put together and everything else, the 7 teachings. I mean, I have it up in my office. I carry it with me. I make sure students are exposed to it. But thank you for doing this. I'm sure hoping that DPI has recognized this and that it's up on their website as another support for school districts. And if not, when I talk to the students that I have all over the state, as well as countries and other states and everything else, I am just so excited that I was able to attend. And again, great work, all of you.
Thomasine.
Thank you, Sherry.
Thomasine and Lavon and David, it was absolutely delightful. This is Gail Rue. Of course, I would remind you that the reward for good work is more work. And what I would like to request is you consider giving a presentation to both the undergraduate group and the graduate group. We have both undergraduate and graduate faculty on this brown bag from all the departments, because as wonderful as you've done within your communities, we probably really have not extended this yet to our own students and practitioners. So I'd like to hear a little bit about that, Thomasine.
Well, we say this all the time, and I see Stephanie Christian, I see her asking us to come into the undergraduate nursing classes where we can talk about the more prepared students come to us to address the mental health needs of students, the less work we have to do. So it really is a process. And I think about my own process of understanding and my learning, and I'm still learning. Levon taught me a lot working on this product, that we're all students of understanding culture, and we all have the capacity if we open our hearts.
So how do you think we can, integrate this into our students in the kind of the most cohesive way?
I think for nursing, I would start with the trauma piece, and David put a bunch of resources that we have on trauma. But to start, when you're dealing with someone, let's just say they're in a hospital setting and they're under stress already, and they're bringing their whole family in. I've been in hospital settings with family members. So understanding that they may need to leave to burn sage, that the practices may be different to adapt, and understanding that. So I think starting with the piece on trauma, and sometimes the settings we put people in trigger their trauma, and understanding that. What's those settings that work? And why, when Levon says, her son's, getting telehealth help out of state. And I hope that's from a provider who understands her son's needs and understands that trauma. So I would start with the trauma piece scale, and then I would move to a higher level understanding. That's where I'd start with nursing students. I'd start there with social work students too, and I'm seeing others online, but to have them understand the role of trauma and have a deep understanding of adverse childhood experiences and the role of ACEs in expanding into trauma. And this isn't just for American Indian or Indigenous youth. This is for many, many of our youth. This is all adaptable.
I agree. Well, thank you so much. It was just delightful.
Thanks, Gail.
Thomasine, I have a question.
You're on mute.
Is this book available or for purchase, or is it just free because of the grant and everything that you guys have done?
It's free because of the grant, right, Levon?
Yes, it is.
This is, I mean, these books are really expensive to produce, as everyone knows, and to print. But if people will use it, we believe this is our signature item. I'll even have David put up a product like this on co-occurring disorders that Dr. Sjogren was the lead on. And some of your nurses are already using this in practice. So yes, the grant pays for it. And we use our grant money judiciously, I'd like to think. And Levon's been great.
It was a great team. It really was a great team to work with. I don't think we would have been able to do it this good without a team like that. So.
And Levon was very patient with all of us. This is my way, right? I just want to say our way is, I started digging into all these stats, right? We've got to get these stats out. And Levon's like, wait, there's a story, you can't just throw stats at people. You have to just sit back and think about the story a little bit and think about, being more inclusive of how you use statistics. So it's always a journey. I'm always learning. I like to tell people that American Indian Center asked me to speak one time about some of the work I was doing curricularly, because I've done a lot of work with tribal colleges, and to tell me, a little bit about the work. And it was for Native American Month, by the way, which is why we rolled this out. And they were having soup, and I did the top 10 mistakes that I've made in my classroom and in my life. These are the mistakes. This is how I learned. This is how I was taught how to correct those errors, and I still make mistakes.
I wanted to just add one last piece. I'm hoping I'm not too unstable. Am I unstable? I thought I'd at least show a picture at the end, but about the turtle. So I don't know if many of you guys know, but the First Nations and Indigenous people call North America Turtle Island. So that's, if you look at the picture, that's how North America and Canada all fits in there with Turtle Island. And it's connected to a lot of Indigenous creation stories, oral creation stories about how after the Great Flood, there was a couple different animals that tried to go down and find Earth, but it was a turtle who did. and the turtle brought up earth, and the turtle sacrificed its life to give us back the land that now is Turtle Island. So when I saw that artwork, I mean, it's perfect. It was perfect artwork for to, you know, to represent how we look at Indigenous identity, culture, autonomy, and how we respect the environment. So I just wanted to bring that piece in there as to why I felt the need, why I hounded that artist quite a bit to get that artwork. So I felt like a stalker. Any other questions?
We have about 3 minutes left if you want to speak to anything else or if there are any questions. And no questions have come up in the chat room. So if somebody has a question, I think you can just interrupt right now.
Well,
I apologize for going so fast too, and my alarm corrected me. So anyway.
You were good. Hey, folks, since you have 2 minutes left, wink, wink, can you be sure and grab that link that David put in the chat box? Because we have to prove that we actually do work. But we love having this product, and I hope the federal government pushes it out. We just heard today from some Alaska tribes who are interested in it. I think some folks in I think it was Washington State. So I hope that this will be used more broadly. And it was a pure delight to do this work. It's always hard at the end, but then the product comes out and you feel such joy. You go to bed one night and you say, I'm doing okay in the COVID environment because we did this. So take care, everyone.